to be on page 30, which is, I guess, chapter number 4 of the notes. So we'll be talking about joints and functions of joints and movements. So probably not everybody is going to be flexible, right? So the joints, the mid part of the bone is where there's a lot of strength in the bone, but the joints are going to be the weaker parts of the skeleton. And we can have different injuries there, joints, sprains. And then articulations are site where two or more bones meet. And then the function of the joints is what gives the bone, the skeleton mobility. And then it holds the different bones together. Now, we're going to classify joints in a couple different ways. We could probably turn the lights, or at least one of the lights on, and maybe open the door back up. Thanks. There's different ways that we're going to classify joints. One of the ways is functional, as far as how the joint functions. And there's going to be 3 different functional classifications. And the first one is going to be synarthrosis. So syn meaning together, and then arthro meaning joint. So synarthrosis, by the name, they're pretty much stuck together. There's not going to be that much movement that occurs between them. And then amphi meaning double, so amphi is going to be a little bit more movement. And then diarthrosis is what are going to be most of the joints of the body, or the freely movable joints. And then we'll talk about them classified as far as structural classifications. And then that's going to talk about how the joints are bound together and what kind of material is holding them together. First classification is going to be fibrous, then you're going to have cartilaginous, and then synovial. And then the synovial ones are going to be the most common freely movable joints in the body. So we'll get into the fibrous joints, and those are going to be sutures. Those are going to be like the joints between the bones of the skull. There's not any joint cavity, there's no joint membrane, there's no cartilage lining. They're pretty much considered immovable depending on who you talk to. So then the sutures, like I mentioned, are sutures in the skull bones, and syndesmosis and gomphosis. We'll go through each of those. So as I mentioned, the fibrous joints are the ones between the joints of the skull. What holds them together is that the nature of the bones where they connect are they're kind of interlocking joints. It's like a jigsaw puzzle almost. And then that's filled with connective tissue fibers. So that's where it gets the name of a fibrous joint. And then eventually the bones fuse, and then they're called a synostosis. Because in an infant you have those openings where the bones haven't grown quite together, the fontanelles, right? And then we'll have a syndesmosis, and those are going to be bones that are joined by a fibrous tissue ligament. And then the example here is the distal tibio-fibula here. And it's going to be some variation in movement in those kinds of joints between slightly movable to immovable. And then the gomphosis basically is going to be a ball in the teeth where a pen fits in a socket. All right, now we'll talk about cartilaginous joints. So obviously by the name, those are joints that are lined with cartilage. Or actually, they're united by cartilage. There's not 2 opposing surfaces, it's just one piece of cartilage in between. And so in this case, there's not going to be a joint cavity. So examples of these are when we're talking about the epiphyseal plates that we talked about last time. That's basically filled in with cartilage. And those are going to be the synchondrosis. And then you have a synthesis, For example, the pubic symphysis, and this has joint surfaces covered with cartilage that the space is filled in with a fibrocartilage plate or a disc. And those are going to be, examples of that are going to be the intervertebral discs and the symphysis pubis. So now to get into more detail on these, the cartilaginous joint, which is also called the synchondrosis, is where a bar or a plate of hyaline cartilage unites the bones. And that's going to be like in the epiphysis. And there's also a few other areas in the body where we'll talk about that has disc in the particular joints. For example, here between the first rib and the sternum. And then now we'll talk about the symphysis. And this has hyaline cartilage covering the articulating surfaces of the bone, and then it's fused in between with a pad of fibrocartilage. And that's going to be like here on the intervertebral discs. And these are joints that are designed to take a lot of weight, and they're stronger joints. And then now we get to the joints that are compose the majority of the joints in the body, which are synovial joints. And then this is where you have the articulating surfaces are lined with cartilage here, and then they're freely movable joints. They're called the diarthrosis. Di meaning two, so there's typically going to be two different ends that are both lined with cartilage and surrounded by a joint cavity. And synovial meaning together, and then ovum as in egg. So basically, it got that name because the joint fluid inside is kind of like egg whites. It's got a thick, viscous material that helps lubricate the joints. And the cartilage actually has crevices and nooks and crannies in it that are, the synovial fluid sits in those spaces. And then when pressure is applied, then there's still some joint fluid in there to lubricate the joint.
I think that synovial fluid is actually going to be fibrous. Is that true, or is it more fluid?
Not really. It's more of a fluid. You know, just think if you want to lubricate something, you want like like in your car, you put oil in it, right, or grease in the axles. I mean, the synovial membranes that line it, we'll talk about, can have fibrous tissue in that. So these are the things that you're always going to find in the synovial joint. Articular cartilage, the joint cavity, articular capsule that goes around it that holds in the fluid, the synovial fluid itself, and then it's typically going to be reinforced with ligaments. So, and we'll talk more about certain types of ligaments. Some are going to be intracapsular, some are going to be extracapsular. And some will be intra-articular and extra-articular. So then here's just the general structure. So here you have the cartilage, there's the joint fluid, and then the membrane is going to have two different parts of it. It's going to have a fibrous capsule on the outside and then the synovial membrane on the inside.